Today we are going to talk about the recent formulation of patient-provider relationship as an ethical issue that arises during the practice of medicine. Now, the debate is over the role of patient in the decision-making process, which appears as a conflict between patient autonomy and patient health, just patient autonomy and patient well-being, and physician values of the profession and patient values of life, because there are values for physician as related to their profession, and there are values for patients in their life. Now, how the argument goes related to what's the ideal relationship between the physician and the patient. Some argue that the ideal physician-patient relationship calls for what? For greater patient control over decisions that affect him or her directly. This is the proponents of the patient role in the decision-making process, that the patient has to be given more control over the decision that affect him. Now, the counter argument for this is that this ideal of patient control fails to acknowledge the imbalanced nature of interaction between a sick person seeking technical help and another person who has the technical expertise. So those are the opponents of patient control over decision making, says that they failed, the proponents, they failed to acknowledge the imbalanced nature، العلاقة غير المتوازنة بين الطبيب، بين مريض يسعى للمساعدة وبين طبيب عنده expertise to provide this help. Now, the third argument stands in the middle between the two of them, which is called the mutual relationship. That is a complementary relationship. That is, everyone in the encounter has his or her role in the relationship, talking about the patient and the physician. Now, the question arises that what is the ideal physician-patient relationship? There are so many models put forward to explain what is the ideal physician-patient relationship, but they came up with the more famous four models to be discussed here, which is the paternal model, the informative model, the interpretive model, and the deliberative model. Talking about the paternal model of patient-provider relationship, in this model, the aim is to ensure that the patient receives the care that best promote or restore their health and well-being. In this model of patient-physician relationship, this model is used with an aim that the patient receive the care that best promote or restore their health and well-being. The strategy used in this model is that the physician uses his or her skills to diagnose and select the intervention or the treatment that best restores health. And then, after diagnosing and selecting the intervention, the physician presents the patient or tell the patient or inform the patient with a selected piece of information. Selected means he used to select the piece of information or the information that encourage the patient to accept the intervention he decided for it. What is the assumption here in this model? The assumption that both the doctor and the patient share objective criteria that determine what is best for the patient. Now, this is an assumption that both of them share a similar assumption, which is an objective criteria that both are looking for the best for the patient, physician and the patient. Then the doctor will apply these criteria without patient intervention. Since they share these objectives that we are looking for what is best for the patient, then the physician will interfere to apply this criteria without patient intervention. And the patient will be thankful even if he or she would not agree to the decision made by the doctor. The patient has to be thankful even if he internally disagree with what the intervention the physician has selected, but it is the physician role. And the patient has to be a recipient for what the physician decides for him. In talking about patient autonomy, is there a patient autonomy in this model? Or which means that can the patient decide for himself, or what kind of decision the patient has to play in this model? In the state of tension between autonomy and well-being, the doctor emphasizing the latter. Now, in this model, the comparison between patient autonomy and patient well-being, from the physician perspective, he is looking for the patient well-being as taking a precedence over the patient autonomy. And the conception of patient autonomy here is in his or her agreement to what the physician determines as the best for the patient. So this is the small role of patient autonomy in his agreement for what the doctor determines as the best for the patient. Now, what is the role of physician here in this model? The physician is the patient guardian who selects what is best for the patient. So the role seems that the role is huge because he's acting as the patient guardian. But this is why it's called paternal, and the child and the patient as a child, and the parent, who is the physician, will select what is best for the patient. In this case, the physician is obliged to be collectivity oriented, which means that he is putting the patient interest in front of his or her own interest. This is what's called the paternal model. Now, if we look into what is the informative model, and some call it scientific model or engineering model or the consumer model. In this model of patient-provider relationship, the aim is for the doctor to provide patient with all relevant information. In the paternal model, the physician provides the patient with selected information. Here, the aim is to provide the patient with all relevant information for the and then the patient will select the intervention that he or she wants. Then the doctor go and execute what the patient selected as a method of intervention, which is totally different from the paternal model here, that the physician provide information and all the relevant information, and it is left for the discretion of the patient to select the intervention, and once selected, the physician goes and execute the selected intervention. The strategy here is to provide patient with relevant information, including what? What are all relevant information? Patient disease state, the nature of possible diagnosis, which is the provisional diagnosis, and the therapeutic interventions, which is if there is more than one line of therapeutic intervention, he has to describe it to him. And what are the risk and benefit of each method of intervention? And if there is any uncertainties in knowledge, like maybe a recent intervention or line of intervention is still debatable or still in the experimental stage or still not agreed upon by the total community of physicians, again, he has to provide the patient about any uncertainties in knowledge related to each line of treatment. Here, the patient has to know all the information related to his or her disease. The assumption here, there is a clear distinction between facts and values. Clear distinction. So facts is here and values are here, and they are totally separated from each other. So they are distinctly separated from each other. Patient values are known and clear, and what is lacking are the facts. This is what the model assumes, that the patient has values and he needs to pursue these values. All what is lacking is the facts about it. Let's take an example, like if he's going to do cosmetic surgery. Patient does cosmetic surgery based on his values. Based on his values, what is left is to gather information about the facts related to this. What is it? Is there any risk or benefit from it? Any uncertainties about the case? So there is a clear distinction between the patient values in seeking help and the facts related to the disease at hand. The physician role here is a technical expert. This is why it's called engineering model or consumer model. Consumer model means that the patient agrees or select the intervention, and the physician, as a technical expert, he perform this selection. What are the doctor's values here? As a profession, he has no role, because all what he needs to do, apart from his professional values, is to agree to what the patient select as intervention method for his treatment. What is the role of patient values? No role for physician to understand patient values. He doesn't seek to understand why the patient needs to do so and so and so. The patient, the assumption, has his own values, and based on these values, he opted to select this line of treatment, and the physician has no right or no role to try to understand what are the patient values that led him to select this intervention strategy, nor to judge the worth of these values. Even if he knows these patient values, he has no role for judging the worth. Is it worthless value or worthy value? He has no role in even identification the worthiness of these values. The physician's obligations here is to provide truthful information and maintain competence in area of expertise, because he is the expert and he has to maintain competence in this area of expertise, and to consult others when skills or knowledge is lacking for him. He is obliged to consult others when skills or knowledge is lacking. What is the role of patient autonomy? Conceived in patient control over the medical decision. As you can see, it's clear that the patient here is in total control over the medical decision. Physician provide information, patient select the line of treatment that suits his values, assuming that suits his values, and the physician execute this line of intervention. So the patient autonomy here is conceived as in patient control over the medical. In paternal model, patient autonomy is just a piece of autonomy represented by his agreement to the line of treatment selected by the physician. What is the interpretive model? Interpretation means tafsir, interpretation, tarjama. The aim of the patient-provider interaction is to clarify the patient values and what they actually want. Then the aim is to clarify here the patient values, make it clear, and what they actually want. what the patient actually wants, which is different from the informative model that the assumption is there a clear distinction between patient values and the facts, and the doctor role in the informative model has no right or no role in understanding what the patient values are, but in the interpretive model here, the aim is to clarify the patient values and what the patients actually want. After clarification, then he help. This is clarify and help the patient to select the intervention that realize these values. So he helped him in selecting a line of intervention after due consideration for the patient values after have been clarified. So he select or help the patient to select the intervention that goes in line with the patient values. The strategy here is again like the informative model, provide patients with information on the disease state, nature of possible diagnostic and therapeutic interventions, risk and benefits of each method of intervention, and any uncertainties in knowledge related to that disease. The second is to assist the patient, assist, he helped the patient to identify and clarify his or her values. So he helped the patient to identify and clarify the patient values, which means that he assists the patient in making his values more clear. And then determine the medical intervention, or assist the patient to determine the medical intervention that best realize these values or wants. What is the assumption here? Is that the patient values are either not known or partially understood to the patient. From the aim of this model, which is to clarify the patient values, the assumption here that the patient values are unclear, and what is needed is to clarify them, or sometimes unknown. He doesn't know. And again, he tries to interpret what the patient wants based on his or her values. And the second assumption that the doctor must work with the patient to clarify these values through reconstructing patient's goals, aspirations, and commitments. How you can clarify these values? By trying to go with the patient in discussing the patient goals. What your goals in life, in this mission, and in work, and goals? What is his or her aspirations as patient? What is his or her commitments in life? So by clarifying these things, the goals and aspirations and commitments of the patient, means that we are coming more clear to clarify the patient values based on these goals, aspirations, and commitments. The doctor has to look to the patient life as a whole. So by discussing patient goals, aspirations, and commitments, seems that we are looking for the patient more than the physical unity of the patient. We are looking for the patient life as a whole to specify the patient values and their priorities. What is the doctor role in the interpretive model? Doctor does not dictate to the patient the diagnostic and therapeutic intervention. Again, he does not dictate. Dictate means يجبر الطبيب إنه يختار the line of intervention that's required, and it is the patient who decides which values and actions that best fit him. So he clarified the values. By clarification of the values, the patient then decides which values he is pursuing, which values that goes with his goals, aspirations, and commitment, and what are the best interventions that fit these values. the doctor never judge the worth of patient values. Again, the physician has no right, or in this model, does not, it's not required to judge the worthiness of the patient values. Patient value. Patient has a value. As I said before, that a lady who wanted to postpone a surgery because she wants to attend her daughter wedding, this is what the patient values. Whether it is worthy or not worthy to postpone operation because of the wedding, we are not in this model. The physician has no right to judge the worthiness of this value, but help the patient to understand their values and use them in the medical decision. The role of physician here is a counselor. You counsel with the patient. Counseling means that the patient has to decide, and the physician try to help or assist or guide him or clarify him for what the best decision for the patient to take. What are the physician's obligations? Again, similar to the previous model, that he has to provide truthful information. He has to maintain competence in his area of expertise, and he has to consult others when skills or knowledge is lacking. And added obligation over the informative model is that the physician is obliged to engage patient in the process of understanding. He went beyond the disease state of the patient or the physical illness of the patient, and he engaged the discussion with the patient in process of understanding the patient values. Obligation in the paternal model is that collective orientation with the patient interest first. The obligation of in the informative model include the above three, but in the deliberative model, in addition to the above three, added is to engage the patient in a process of understanding. What is the role of patient autonomy here? Conceived as self-understanding. By the end of this discussion, the patient will come up by more understanding for his values and his decisions. So it is conceived, the patient autonomy here conceived as a self-understanding. He started to become more understandable of what his or her values are, and the patient comes to know more clearly who he or she is, and the various medical decision bears on this identity. So it came up looking into the whole life of the patient, then the patient start to understand more and more about his or her values, and those values are going to guide the medical decision. The fourth model, which is called the deliberative model. And the aim of this, of patient-provider interaction, is by helping the patient help the patient determine and choose the best health-related values that can be realized in a clinical situation. Here, as you can see, the model is focusing more on values, and only those values that are related to health, not all patient values. He is stressing or focusing or trying to help the patient to determine what are the patient values that are positively associated with his health if adopted. It's clear that here in the deliberative model, the main focus is on the patient values that are conducive to health, not other values. The strategy here, again, the doctor provide the information, provide the patient with all information related to the clinical situation, then help the patient to clarify the values within each option. Now, provide information and try to collect all the values that help in the clinical situation as related to those values. Again, means that what are the habits or values, what the patient should value in order to help in the clinical situation. Then to clarify the values within each option, which means the options of lines of treatment or this, diagnosis, and which values that help in, in, in the success of that intervention line. The doctor suggest again why certain health-related values are more worthy and should be aspired to. Now, the talk of the physician here seems more solid to the patient. And he is suggesting or trying to convince, if you wish, the patient of why he needs to adopt any value that is related to health as a more worthy way of life, values. So the physician tried to persuade the patient the worthiness of those values that help him to stay healthy or to cure him. The doctor might deliberately tell, this is why it's called deliberative model, deliberately بحكي بصراحة, deliberate, tell the patient what kind of health-related values the patient should pursue. يجب عليك أن تتبع هذه السلوكيات. Stop smoking. Why you stop smoking? You enjoy smoking. The patient says, I enjoy smoking. Now, the focus of the physician here to try to explain why he should stop smoking and what are quitting smoking, the worth of quitting smoking to his health. So he's focusing here on health-related values like smoking, like eating, like taking the medication, like measuring his blood glucose, like these are. I don't like to follow a certain food pattern, but the physician in this model tried to convince the patient why he is required, why he should adopt this healthy food, although maybe taste not good, in order to stay healthy. So he is looking for any value related to the health. And the physician here should only discuss values affect or are affected by the disease and the treatment, but not other values. We are looking for the values that help in the disease cure and help in treatment. Maybe the doctor here aims at no more than moral persuasion. As you can see, the physician is more clear in telling the patient what are the values that the patient should. Though in ethics, we always say you ought to, but especially in the deliberative model, maybe the physician selected the word should instead of ought because his focus or to stress the importance of any value that is related to the health. So what he's trying to do is to morally persuade the patient، يقنع المريض بأهمية هذه الفاليوز، أهمية هذه السلوكيات، بأهمية هذه القيم اللي أنت أنها لصحته. And patient must define his or her life and the values that need to be espoused. So now, as if the picture is turned around to focus on life and what are the things you should do in order to maintain a good or healthy life. The doctor and patient have to deliberately judge the worthiness and importance of health-related values. In the interpretive model, the patient is not required to judge the worthiness of the patient values. I need to attend a wedding. But if it is in the deliberative model, the physician deliberately judge the worthiness of this values. Can tell it's not worthy. Your health is much more important than attending a wedding. That's in the deliberative model. The role of physician here is a teacher, not a counselor like the interpretive model. A teacher or a friend. Why is called a friend? Because the friend between friends, the talks between friends is liberal and deliberate. They can tell each other what they feel, and here is a teacher again can tell the student what he should or shouldn't do. And because of this relation, which means that in the deliberative model, this relation is so strong that make the physician go deliberately and tell the patient more clearly what are the values that should be adopted in order to remain healthy. And this relationship with the patient and wishing him the best, the doctor might not only tell patient what he or she could do, but what should do. يجب عليك مش ينبغي. يجب لأنه بحكم العلاقة اللي بيناتهم الطبيب صار يحكي مش ينبغي يجب. What decision regarding medical therapy would be admirable. What is the role of patient autonomy here? Conceived as a moral self-development. Development mean تنمية مش تطوير. بدأ يحس إنه ممكن يتطور صحيا أكثر لأنه النقاش كان حول كل القيم والعادات اللي بتنشط أو بتحافظ على الصحة. وبالتالي came up from this discussion that the patient came up as a moral self-development. He started to focus on what the values that are related to health. Patient is not to adopt unexamined values. This is another dimension of this discussion that I shouldn't adopt any value without examining the worthiness of this value, because this is what happened in the deliberative model. We judge the worthiness and the importance of the patient values, but to consider alternative health-related values and their worthiness and their implication for treatment. Now, to make the models more clear, we try to compare them on this clinical case. As you can see, this clinical case, 43 years old female, who reported with a localized breast mass with no spread, no axillary lymph nodes involved. Now, this localized breast mass was diagnosed as cancer, but still in the localized stage. Added to this, which is the social history of the patient, that she is recently divorced, which means economically is not supported, and she has to go back to work to support herself economically. So this is a lady, 43 years old, recently divorced, and she has to work, and she had got a breast mass that is localized without no spread. If the physician to adopt the paternal model, what would say? He might say that there are two alternative therapies to prevent the spread of the disease. Lumpectomy, remove the mass from the breast, plus radiation. The second line is mastectomy, taking the whole breast. Now, the doctor might add that both lines of treatments, so account lumpectomy plus radiation or mastectomy, are equal in terms of survival rate. 5 years survival or 10 years survival are almost the same, but the first is better for cosmetic reasons. Now, this is what the physician is telling the patient, that the first is lumpectomy, taking the breast mass plus radiation. Plus radiation for cosmetic purposes is much better than taking the whole breast. He will add also that, okay, now I'll send you to the radiation department to schedule the program of radiation for you. And he adds also, even though recurrence is low, you are still young, and we need to minimize the chance of spread even more by adding what? Chemotherapy. Chemotherapy, some studies, and this is the physician's talk, some studies suggest that it is effective in preventing or delaying the spread of the disease. Chemotherapy, again, he adds that it is a hardship versus an added years of life. Hardship, the bad side effects of chemotherapy versus an added years of life. By using chemotherapy, maybe we can add some years of life. As you can see here, the patient did not say any word. In the paternal model, all the talk, all the discussion is from the physician perspective. Line of treatments, and he suggests the equal, because of the equal survival, suggests the first one for cosmetic purposes. Again, he ordered the patient to go to the radiation department to set the program. And he talking about the chemotherapy and its effectiveness. And he selected what? Hardship over versus years of life. We can tolerate the side effects of chemotherapy in order to add few years of life. This is typical paternal model. Now, if he's going to use the informative model, what he would say? He would say that with node negative, there are two issues to be discussed. Node negative means the axillary lymph nodes are not involved, only the mass is localized to the breast. Now, there are two issues here to be discussed. Local treatment, which is either lumpectomy or mastectomy, plus radiation. If we add radiation to lumpectomy or mastectomy, 10 years survival is 80%. You know the effectiveness of the therapy in cancer. We measure it by the years of survival, like 80% of patients who took lumpectomy or mastectomy plus radiation, 80% of them will survive till 10 years, for 10 years. Without radiation, the recurrence rate is about 30 to 40%. So it's giving the negatives and positives of radiation here. The second issue to be discussed is the systematic treatment. Chemotherapy prolongs survival for axillary lymph nodes involvement, but not clear for lymph node negative patients. This is what he's talking about chemotherapy here. The paternal model said chemotherapy might, in some studies, found to be effective, but here he is detailing the effectiveness of chemotherapy that is only effective when axillary lymph nodes are involved, but not when the axillary lymph nodes are negative. So it seems that he is telling that no need for chemotherapy, but he's not saying that. He's saying that chemotherapy is only effective when axillary lymph nodes are involved, but not lymph node negative patients. Now again, he goes further and say that, okay, I knew that the National Cancer Institute indicate that chemotherapy is of benefit for women like yourself. This is an added piece of information based on what the National Cancer Institute says, that chemotherapy is of benefit for women like yourself, maybe because she is still relatively young. Now, again, he informed her about the clinical trial. You know, if the new medication comes out, before giving it to patient, they do some what's called clinical trials, and they try it in certain voluntary patients. Now, this is what he's telling the patient, that there is a clinical trial goes on regarding a new therapy for breast cancer, which is you are eligible to be included in the clinical trial. And the clinical trial, you know, they take the patient and do all the investigations, do all the follow-up, and providing the new medication for them and measure its effectiveness. Now, if you want, I can enroll you. I can enroll you if you want. Again, this is piece of information added to the patient, and he suggested that I can enroll you in the clinical trial study if you want to. You can see here it is just informing the patient. Two issues to be discussed. He's discussing these two issues: local treatment, systematic treatment, and some added information about the National Institute chemotherapy benefit and the clinical trial that goes around. So this is typical of informative model. As you can see, for the same patient, these three models are totally different from each other in approaching the patient problem. In the interpretive model, again, the physician outline all the information mentioned in the informative model and then engage with patient in discussion to clarify the patient wishes. Remember, we talked about the obligations, physician to provide information, disease state, and then. And the last point is to engage patients in discussing, to clarify patient values. And for this lady, 43 years old, he's trying to discuss now to clarify her wishes. And this is what he says. It seems you have conflicting wishes. It seems you have conflicting wishes. هو قاعد بتطلع عليها وبيحاول يشوف شو وضعها أو شو رغباتها بهالوضع اللي هي فيه. وبقول لها إنه it seems you have conflicting wishes. الوش الأولى اللي هو the demands required for additional treatment like the chemotherapy, and the demand for your personal life, the demand for or commitments or aspirations or goals for your personal life, being divorced and now she has to go back to work, still 43 years old, maybe she is looking for marriage again. So these are the demands for a personal life, which seems in conflict with what is required for additional years of survival. Now, while maintaining your psychological equilibrium, You know here what is the demands required for additional treatment? Radiation and chemotherapy. What's the effect on the body? First, lumpectomy is more cosmetic. For a 43 years old and she wants to go out to work and socialize with people. The side effects of radiation and chemotherapy الشعر بنزل حالة بتكون نوزيا وفوميتنج والهيديك وبالتالي هو بقول لك انه انت حابة تعيشي حياتك الخاصة لكن اذا تعرضتي للعلاج اللي بده مشان تعيشي اطول هذا بتعارض مع تعرضك لحياتك الخاصة. إذا بدك تاخذ كيموثيرابي وراديشن ثيرابي معناته لازم تقعدي بالبيت، وإذا ما بدكيش تاخذيها أو إذا بدك تطلع من البيت معناته مش لازم تاخذي الراديشن أو الكيموثيرابي in particular. وبالتالي في conflicting wishes with the lady. Now, this is what he says: you want to fight cancer. بدك تعيشي أو to fight cancer while having a healthy self-image. ما تخسريش صورتك الاجتماعية والصحية قدام الناس. and the quality time outside the hospital. and the quality time outside the hospital. حياتك الاجتماعية بدك تحافظي عليها by maintaining a healthy self-image وبنفس الوقت بدك تحاربي الكانسر. Given the new change in your life, new changes, divorce, she has to go back to work. This view goes with what? Having radiation but not a controversial chemotherapy. التغيرات الاجتماعية اللي صارت عندك معناته هذا بقول لنا إنه okay, we can go to radiation but not a chemotherapy that is of controversial efficacy. والأخير بقولها do I understand you. وبالتالي إذا بتلاحظوا إنه هو قاعد بيحاول يحلل شو رغباتها شو بدها وبيشرح لها بقولها it seems إنه you are like to fight cancer at the same time you need to preserve your health self-image. إذا هذا الحكي هذا معناته والتغييرات الاجتماعية اللي صارت عندك تتطلب مننا نعمل راديشن بس ما نعملش كيموثيرابي سيمبلي لأنها controversial still of controversial efficacy. الآن بسألها بقولها do I understand you. We can't talk again. So he is clarifying here the patient wishes. This is what's called interpretive. بحاول يترجم what are the wishes of this patient. Still, he did not interfere in anything. All what he says is trying to clarify the wishes, and he asked whether he understood her or not. The physician in the deliberative model will go again, outline all the information as above, and engage in elucidating the patient values. Elucidating the patient values. Now, like the interpretive method, trying to clarify the patient values. But again, he goes beyond that, beyond the clarification of patient values, by saying, okay, it seems surgery and radiation is the best choice. It offers maximal survival and minimal risk, minimal disfigurement, and minimal disruption of life. Chemotherapy is a conflicting issue. The best is to enter the clinical trial. He suggests to enter the clinical trial. Why? Because it ensures receiving the best care and because it is altruistic to participate in this study. Altruistic to participate in this study صار يخاطبها هون بالقيمة الوطنية بالقيمة الإنسانية للإنسان إنه أنت لازم تساهمي بهذه الدراسة مشان مشان الأجيال القادمة للستات اللي بتنعالج بريست كانسر in the future. وبالتالي it is altruistic. altruistic معناه وطنية، معناته واجب وطني إنه أنت تشاركي بهذه الدراسة. Look, he's tried to focus on a value that is related to the future help of the help of future women with breast cancer. And if you agree to this, then you need to go to another expert who will arrange that for you. Now, the tone and the language in the deliberative model of the physician, he goes all through the language and the interpretive model, but he is adding certain things that the patient should, not would. The surgery, he's recommending the surgery and radiation as the best choice, and he explained why. Chemotherapy did not suggest it, but he recommended entering into a clinical trial for best care and for it is altruistic. And if you agree to that, then we can arrange you with that. Seems clear that from the single patient for a single case, all the four models are describing different things depending on this the relationship between the patient and physicians. Thank you.